Welcome to the Clinova Podcast, where we're advancing access to specialized recurrent UTI care and innovative solutions for patients seeking answers, relief, and lasting recovery. Today, I have Sarah Sharp, who I would describe as an expert in patients navigating the complex care spectrum of recurrent urinary tract infections. Sarah, thank you for being here today. Please tell us a little bit about yourself.
Thanks so much, Dr. Bonder. So happy to be with you today. Yeah, so my journey kind of started really from day one for me. I was born with spina bifida myelomeningocele, self-cathing my whole life. Lots of rocky starts with that in the 90s specifically, being taught that it's okay to reuse dirty catheters and not really knowing that that wasn't an appropriate way to handle my healthcare. So I got started with complex UTI pretty early on, but I will say I was under really collaborative care that was multifaceted through a pediatric hospital in a large metropolitan area where spina bifida patients, pediatric patients were able to get really comprehensive care and lots of guidance. So I feel like my childhood was extremely stable going into my early 20s when I was kicked out of the pediatric program and then really had to kind of scramble to figure out where I was going next for my health care. That is ultimately what led me from Wisconsin to Tennessee, where I started my care in Nashville. And they had a comprehensive adult spina bifida care program, which is very, very rare. So it was super exciting, which then proceeded to disband within 6 months of me making the move from Wisconsin to Tennessee. So I had to very quickly navigate a lot of murky waters of kind of piecemealing my care together, which unfortunately came at a really difficult time in my life where I was recognizing that my needs were changing and shifting quite a lot. It resulted in a bladder augmentation, lots of changing anatomy that I was not prepared for, that was kind of urgently needed. And this is sort of what propelled me into the world of more complex recurrent UTI care. That's where I'm at today. I am fully colonized with Klebsiella, antibiotic resistance all around. And so for the last several years in general, it's been this huge journey of trying to figure out what my options are. Where does the hope lie? Where are the nuggets of hope that I can hold on to, and who can I work with where I can have collaborative care? So that has kind of been my journey over the last few years in particular, and it has been far from perfect, but I'm still here, so something must be going right.
I like that optimism. And throughout that journey, I'm sure you've become an expert in the complexities that come with navigating such a significant medical condition, as well as navigating just the medical system in general. A lot of patients run into, okay, do I reach out to, the OB-GYN about this or the Uro-GYN about this? Do I go to my PCP? Is it infectious disease? Is it urology? And so what have you found when navigating that? Have you found that, is it best to have a point person as a PCP kind of directing all of this? Have you found that more of your care has best been directed through a urologist? Or is it, the collaborative approach that has really been helpful for you?
Yeah, so I think what's missing in my particular case is more of that collaborative approach. That's really what I kind of yearn for and feel like would be best for me in the long term. As it stands right now, what's been most important for me holistically is to have a great PCP who understands my complex background and is there anytime that I have questions or concerns. Especially since urology, infectious disease, you can't contact them as frequently as you might be able to contact your PCP. Yes. They have larger patient panels. You have to be cognizant of that. And you're often getting responses from their medical staff versus them. Whereas with a PCP, I can go straight to the source, explain what the problem is, create a plan of action. They can even advocate on my behalf if I'm really ill, if needed. I've done a little bit with concierge medical care, primary care, urology, nephrology, gynecology. Infectious disease has been my saving grace in my particular situation, especially since the Klebsiella came into the picture. I wish that there was more of a cohesive collaboration between my urology team and my infectious disease team. And to their credit, I think both sides are really working to try to make that happen. So that's been super important to me. But I think kind of taking a step back, I laid a lot of strong foundational care in trying to find the right people for me years ago when that adult spina bifida clinic disbanded. It took me probably 5 or 6 years after that to feel like I had found people who heard me, understood me, wanted me to play an active role in my care. So that was extremely important to me. And I think it's important for patients everywhere to recognize you don't have to settle. You can find people who are your people, who are there for you, and you should spend a lot of time trying to do that, because they will take you through some of the most challenging times of your life.
And one of the things I think you hinted at was it's really the access and accessibility to care, especially for something that needs such quick action like a urinary tract infection, which, in complex cases can easily turn into sepsis or pyelonephritis. And so it's difficult if, you're having to jump through the phone tree of trying to get a hold of your specialist just to know, hey, is this something that needs to go to the hospital? Do I take an antibiotic, or is there a different option? And so I think it's really important to highlight that the access to care, and especially someone who's going to be your point person, it seems from what you were describing to be extremely important.
It is extremely important. You have to understand the limitations of the health system in which you are currently existing. You have to recognize that people are just people, no matter the title. And you have to play an active, proactive role in your care just as much as your care team does. So to go into situations like this already having kind of a plan of action in place is not only really comforting, but it's essential for your health and well-being.
Yeah, and that action plan is so important. And something that I try to emphasize as well is if A happens, you do B. And just so you have something to anticipate and have some strategies to help mitigate some of your symptoms or, your infection, I think is really important. And that proactive role instead of reactive, I think is extremely important.
100%. People, I think, too often place their lives in the hands of the providers that they're working with and just kind of say, well, whatever will be, but it doesn't have to be that way. You can be prepared. Even in these situations where sepsis could be imminent, at least you have a plan.
Yeah. And advocating for yourself, I think, is important as well. To make sure that you're saying, hey, my symptoms are real. Hey, something's happening. I know my body and I know that something's not right. And then making sure that you're able to get a hold of your provider to get the next step once you've already utilized your action plan, I think is something else I would be important for patients dealing with similar symptoms such as recurrent urinary tract infections.
Yeah, it's definitely been valuable for me.
So, Sarah, to let people in on this a little bit, we had met during the UTI Global Alliance where you were able to talk about your journey and some of the specific medical procedures that you've tried and had to go through. One of the things that I would love to touch on is some of the more advanced treatment options that you had to undergo, as well as that remain a viable option for someone who has, Klebsiella that's resistant to multiple different treatment options. Can you touch base on some of the treatment options you're currently utilizing? And, if you're comfortable with it, going into some of your medical history of, some of the advanced treatments you've already tried.
Yeah, absolutely. It's pretty complicated. And to be totally honest with you, it's been a trial and error kind of thing over the course of the last few years. The Cleveland Clinic, I think, has been the most innovative in offering suggestions in terms of like daily maintenance of my bladder health, things with, regarding routines of like bladder cleanouts that are on a daily basis. For me specifically, a piece of my colon was utilized to create a new urethra through my belly button when I had the bladder augmentation. And because of that, that piece of colon doesn't realize that it's not attached to a colon anymore. So it still continues to make a lot of mucus, which then really gets caught in the many diverticula that I have within my bladder, which I've been told I have cute little Mickey Mouse ears. So just imagine all this mucus getting stuck in my little Mickey Mouse ears and just really becoming more of a breeding ground for the Klebsiella and other problematic kinds of bacteria in my bladder. So very early on, the Cleveland Clinic said, this is something you need to do every single day, at least for the first 6 months to a year after surgery. And then hopefully your body will calm down, adjust. That piece of colon maybe won't think it's in the colon anymore and it won't make quite as much mucus and it won't be so problematic. So I very quickly learned how to do these bladder cleanouts, sometimes with bleach, sometimes with vinegar, sometimes with salt, sometimes not. Online communities of pediatric patients and adults with spina bifida were really invaluable during this period because so many other folks had been through something similar and already had great ideas for recipes, as we call them, for bladder cleanouts. I found great success with that, but it was frustrating because nothing was slowing down the production of the mucus even years into me having these procedures done. And so that really set me off on a course of trying to figure different things out for myself, which really the UTIGA conference kind of inspired some additional searches once I got to hear about research and different things that were being tested. One of the things that UTIGA actually sort of uniquely led me to through the assistance of AI would be NAC supplements. And I'm not going to try to pronounce what the NAC stands for. Maybe you know, Dr. Bonder. All I can say is from a patient perspective, this has decreased the amount of mucus production in my bladder by probably 60 to 75%.
Wow.
So now I can skip doing those bladder cleanout routines 2 or 3 times a week without consequence. And that's wonderful because as a person who likes to travel, carrying around sterile containers and syringes and vinegar and salt and trying to fly with these things over lengthy periods of time, as you can imagine, is really problematic and challenging for a number of reasons. That gave me such a quality of life. And no urologist, no infectious disease doctor, anyone in my toolbox has ever told me that that would be a good option until I brought it up myself, at which point they affirmed they've known for a long time that that's been really helpful. So that's kind of been a general synopsis of my journey of I really know that this can be better than it is. I don't have evidence to support that, but I know that I can find it if I just do the work. And so a lot of my day today is kind of consumed by what's the biggest prevailing symptom that I'm experiencing. Let's utilize this wonderful AI technology and try to understand the limitations of it, but also the benefits, and then loop in my medical team to see if this is an avenue that makes sense. Test it out on myself. What the doctors don't know doesn't hurt them, and so often I will test things out on myself because I want to know what that's going to be like, and then I can go take that evidence to them and see if they support what I've been doing. So that's kind of largely been the approach to date that I've had.
And a lot of these therapies that you've been utilizing are actually directed into the bladder, correct? A lot of these washouts that you're talking about, installations and direct targeted therapies are mainly what we say intravesical or into the bladder. Is that correct?
Yes, so definitely the bladder cleanouts for sure. There was a period of time where I was using powdered D-mannose in those installations. Now I have since gone to doing supplements for D-mannose, cranberry, the NAC, as I mentioned. Most all the medications that I take are supplements to try to support the vaginal and bladder ecosystem. So there's also a lot of probiotics, things of that nature, and it's trial and error. So sometimes I'll instill certain things. Other times I'll do supplements. Other times I'll do liquids of these medications. It really just depends. And then I'm very closely kind of monitoring with notebook notes what's happening to me, what I'm feeling, if I think there's progress, and then just constantly trying new things to see what may or may not help.
No, it's great to hear that you're advocating for yourself and your health. And I think that's important to really note is that if you don't do it, no one else is going to do it, or at least finding a provider that's going to take charge with you, right? Someone who's really going to advocate, no, this is the next step. This is what you need. If these symptoms come up, this is what you're going to do, and creating that action plan and also coming up with unique and innovative solutions for you, I think is really important to make sure that it's a personalized approach, not just this one size fit all, which I'm sure you went through a whole journey of antibiotics, oral antibiotics, and the side effects that come with that, because one of the important topics that you also mentioned was the ecosystem and how all of that works together and how the oral antibiotics affect the entire ecosystem rather than this targeted therapy that you're utilizing at this time.
100%. That has really been an eye-opener for me. No one really explained to me the connection in a woman between vaginal health and bladder health. Seems like something that should be obvious, but it really wasn't, because especially growing up as a woman with a disability, sex is not discussed. You don't talk about sexual health, really. People just assume you're not a sexual being when you have a physical disability. And so that was kind of a huge missed opportunity for me growing up, wherein I didn't really make that connection until I was probably in my early 30s.
Hmm.
So now it's been a lot of trial and error with the probiotics. Certainly the antibiotics. I've run through all of them. I've been on drugs of last resort through PICC lines. I've been hospitalized for sepsis previously. I've had lots of damage done to my body over the years from all the different antibiotic treatments, especially growing up in the 90s. It was just rinse and repeat all the time the second you felt a symptom.
Yeah.
Now they're a bit more discerning. They don't want to prescribe as much as they once did, but I'm sure your body doesn't forget that kind of trauma, and it takes a really long time to rebuild that ecosystem.
Yeah, and that's one of the things I always emphasize with our patients too, is you're kind of chasing your tail once you take an oral antibiotic. So not only are you going to address the good bacteria, but you're also, or the bad bacteria, you're also going to affect the good bacteria. And the problem is, how do you, regrow those in a way that's going to then allow for a healthy microbiome rather than one that's now been selected for based off of the antibiotics that you've taken. And so when it's selected for, sometimes it's not selected for with the good bacteria. It's the bad bacteria that may not be the ones that you're treating that now overgrow. And then you're like, okay, well, how do we take another antibiotic to address those? And that's, the journey that we see so many patients go on. And one of the things that you brought up too is, this patient journey between, PCP to urology, to OB-GYN, to infectious disease. And it's a cycle that patients keep going through, and no one seems to be advocating for saying like, hey, my symptoms are real. What I'm feeling is real. And the complications that I'm having from these oral antibiotics, because it seems to be the easiest option in order to, get me treated, is not something that's being addressed. And I think that making sure that you're taking a probiotic with any antibiotic is super important. And I think that's going to allow you to grow the good bacteria and allow you to prevent the next infection, which is just as important as this infection.
Yeah, absolutely. Something that I think does not get discussed enough in healthcare is the risk of C. diff infections,
Yes.
especially with people who have reoccurring UTI. I myself had C. diff for 10 months, had
Wow.
toxic megacolon. I'm surprised I didn't lose my colon at that point in time. I was able to salvage it for probably another 10 years after that. But it was a traumatizing experience where I was convinced I was not going to survive it. And it was from overuse of antibiotics, where I had been prescribed 3 at the exact same time, which is the only time in my life that's ever happened before. It seemed to have just been a situation where they were trying to throw everything they could at the infection, but then it ended up snowballing and becoming so much worse. And that was a reality I wasn't even aware of being a
Yes.
possibility prior to it happening. So that's a really jarring experience where thankfully I came through it, but I had to learn a lot really quickly experiencing that kind of outcome.
So, with what you've learned, what would you suggest patients do to advocate for a similar scenario? There's many patients that we end up treating that have been on oral antibiotics for weeks, months, sometimes years. What would you say for a patient that's going through that? With your experience of the side effects and then navigating the healthcare system, what would you suggest they do to help get them the best outcomes?
Yeah, for me, it was a lot of hard-won victory in believing in myself, which is a really hard thing to do when you're a patient with complex UTI, because so often the healthcare system is quick to question the patient versus
Yeah.
the process. And so you spend a lot of your life in appointments being questioned and being criticized for the way you're approaching something, the way you're thinking about something that's not at the same level as your provider, maybe. And so it's hard to believe in yourself. And I think that would have served me really well 15, 20 years ago, where I could have taken more of the reins, been a more involved self-advocate, and been able to look up and understand the different options that were available to me earlier. This is something I've said a few times before, I believe even to you in our prior conversation. Being at the UTIGA conference as a patient, you never stop to think about all the researchers and scientists and physicians who are involved in the development of antibiotics, who are involved in the products that are being created out there right now to help people in these situations, you feel very alone. The care is super siloed. You just assume that you're on a rock by yourself. But there's so much power within each patient. They have so much knowledge for what's going on in their situation. I think the best advice I can always give is you don't know your potential until it's tested, and you have to lean into that as much as possible. Even though you're sick, even though it's hard and you're scared, you have to push through, because I have found physicians respond so much more to engagement than they do passive patients. So I come in there as prepared as I can, and if they want to laugh at me and say, oh my gosh, you used AI, you used Dr. Google, well, at least that gives us a launching pad to have a real conversation together and have more collaborative approaches.
Absolutely. And I truly appreciate that collaborative approach, and that you had mentioned that you're coming armed with resources. Where are some of these resources that you utilize and that you would recommend that patients evaluate to bring to their providers? Are there any support groups that you currently are active with or were previously active with that patients can find some benefit to then have some ideas to bring to their doctor? Because this type of specialized care is not available to everybody. And so with what you've learned, sharing that with all other patients that have had like experiences allows you to create a wealth of knowledge that then these patients can take to their provider and be like, hey, look, this is where I found that it may be helpful. This is where I found this study that could also add benefit to my condition. Where are some of those resources that you would recommend for them?
Yeah. For me, something that's been particularly life-changing is a Bowel Management for Spina Bifida Facebook group, which has more than 10,000 members. And the stories that people are able to swap from all over the world, it's a global group essentially. You learn about how things are being handled in Europe, how they're being handled in Asia, how they're being handled in the United States, what's working for people, what's not working. There's cutting edge surgeries that are being performed all the time on pediatric and adult patients with spina bifida. And you learn, well, this worked really well. Well, this worked really well for the first year, but after that, here are the problems that we encountered. So community is extremely important and is a totally invaluable resource. That would be the first thing. The second thing is early and often expressing to any provider who will listen to you that you want to be more involved. That is because as a patient, you're not going to have access to the kinds of networks and connections that your providers will. So to be able to say, you have a lot on your plate. Is there any way that patient voice would be helpful in advancing X, Y, and Z? If so, please involve me. That is something I have said more times than I can count. And the UTIGA conference was the very first time that I was ever offered the opportunity to be a part of a patient panel. So I think that goes along with being a strong self-advocate, saying what you think you're good at, what you need, what you want to be more collaborative along with the provider. That's also extremely important. And then AI. You know, it's still relatively new, and you do have to be super cognizant of the limitations because there are many. But if you use it responsibly to help you sort through your thoughts, if you have any kind of intellectual limitations, you get anxious when you're around providers, just being able to have AI to organize your thoughts succinctly so that your provider can hear you in the 5 minutes they get to dedicate to you during a visit. That is super important. For someone who's used it a little bit more frequently like me, it's been an invaluable resource in identifying lots of different supplements to utilize, which is how I've come upon the regimen that I have now.
Yeah, and I think one of the things that you hinted on too is, the short amount of time that patients typically have with their provider, especially someone as specialized with the doctors that you've met with. And I think that coming in prepared with a list of questions, as well as if you can always find a provider who's specialized exactly with what you're dealing with, who can provide the amount of time in order to go through your journey. This is not just a snapshot in time. This is not just a one-time event. There was so much leading up to this that affects the downstream consequences of each action that the provider takes. And so that's why I think making sure that you have put your thoughts together to have a concise format for the patients that don't have access to a provider that's going to talk to them for at least 30 minutes, I think is really important. That's one of the things that we focus on at Clinova is we make sure that all of our visits are 30 minutes. There is so much we have to learn about you. I needed to know that like this antibiotic caused this. This antibiotic gave me C. diff. I've already had this surgery or I've gone through this supplement and this has not worked. And I think that's important to tease out what's going to be the next best steps for you because it's a long journey and we're just getting started on it as soon as we've met you. And so I think one of the things that I would love to hear your opinion on is like, what are 2 or 3 things that patients typically learn too late in their journey that if they had known earlier would change the entire trajectory of their care? You know, one of the things that you mentioned was just being empowered, right? To have the knowledge and the studies going into them, that meeting to say, hey, look, what about this study? Is this a treatment option for me? What are a couple things in your experience that could really help patients get better care?
Yeah. The first thing I think of when you ask that question really pertains to me personally as a patient who's been going through this for so long and has cycled through so many different providers trying to find that right fit. You come into these relationships at times so jaded that you're not really giving people a fair shot and you're not recognizing all that's being done for you behind the scenes. I think early on in my life, I failed to recognize I'm not their only patient. They have a huge patient panel. They're doing their best in a healthcare system that prioritizes speed versus accuracy, one that is not valuing of human relationships. And yet I'm coming in with a set of expectations that's totally unrealistic. So I think as a patient, understanding that there are limitations to the healthcare system that we exist within, and being totally aware of that and open to those limitations and how we can exist in them together is super important because I came into a lot of these appointments really aggressive with a plan of action that was more of a turnoff than a collaborative invitation with the provider. So I think as a patient, number one, you have to be super aware. You are not the only priority. They have lots of things going on. You need to be prepared for what makes the most sense for your situation, while also understanding providers have so many things on their plates. So that's really, really important. I think people also kind of, as I referenced earlier, don't really realize there are so many options out there. You don't have to stick with the same doctor that you've had forever. And sometimes a fresh set of eyes are exactly what your situation might need. You get to learn a totally different perspective. You get to learn different treatment options. Open yourself up to the possibility. Interview doctors. Allow them to interview you. Make sure that you're a good fit on both sides of the equation. So I think that's something I also learned far too late in life. When you are born into a system that has collaborative multidisciplinary care, like someone like myself who has spina bifida, myelomeningocele, you just kind of take for granted that all of these systems work very well cohesively together within one broader healthcare system. And then you become an adult and you realize it's not that easy. There's a lot that goes into making that dream team happen. And to recreate that on your own as an adult is a job in and of itself. So just to be able to maintain your family life, your work life, your healthcare life is very, very difficult. And I think you need to have that plan of action in place. So while there's so many different kind of approaches to that question, I think those are the top things, is really just believing in yourself, but also believing in the people that you reach out to for help and giving them the space with which to help you in a collaborative manner where you're meeting each other as equals who are there for a common goal.
Yeah. And that's one thing I want to emphasize is providers are actually looking out for your best interest. Whether they have the specialized knowledge to address your exact issue may not be the case, but they're going to do their best to try to get you to that person. And even figuring out where that person is difficult. And then going through the insurance process to even get the approval to talk to that person or get the test that you need to get or get the surgery that you need in order to actually treat the underlying cause of this. That's a complex system. And those communications, as you mentioned, with multiple different patient panels and multiple patients that they're seeing in a day is difficult. And while they do their best to make sure that they're there for you and they're addressing your concerns appropriately, it's something that realizing that we are humans, that we are just trying to get the best case outcome for you. And so taking that overall collaborative approach with your physician, I completely agree is super helpful. But making sure that it's the physician that is taking the same mindset that you are looking for your care, right? And that's where physician training is so important, right? Some physicians, have never dealt with recurrent urinary tract infections. Or the thing that I love to quote was, when I was taught in medical school, it was you have symptoms of a UTI as a female, here's your antibiotic.
Right.
Rather than, okay, let's look into the other causes for this. And so that's where I think it's super important of finding a provider that is specialized and accessible in your condition is super important. And so given your wide-ranging experience in navigating the complexities of the U.S. healthcare system, what do you think is the single biggest systemic failure that affects nearly every patient with recurrent urinary tract infections, whether it's access to providers, whether it's the antibiotics, whether it's the lack of advanced diagnostics? What do you think is the most difficult part for patients with recurrent urinary tract infections?
The thing that made me most emotional at the UTIGA conference was the unexpected recognition that the people that you lean on the most, the infectious disease doctors, the urologists, the primary care, they're not aware of the diagnostic progress that's being made by researchers and scientists. The red tape and bureaucracy of hospital systems, I think, really oftentimes block innovation, and it keeps providers from knowing what's out there and offering better outcomes to their patients as a result. I don't think that's a failing of the providers. I think that's a failing of the broader healthcare system. And I think that is the biggest disservice that's being done. That's what made me the most emotional at the conference. There's all these great things out there. There's a new antibiotic that's been presented by GSK, and my healthcare team wasn't even aware of it until the UTIGA conference, and it had been on the market for a year. So those things are wild to me, and that is the kind of thing that really stops me and makes me think there's always hope, because there's always an answer out there that someone isn't aware of because of the siloed and fractured way that our healthcare system exists. And as bleak and sad as that sounds, it's also wildly empowering, because that means there's always an option.
There's always hope, and there's always a new treatment option out there. There's always a new diagnostic. And one of the ones that I'm actually most excited for is some of these more advanced diagnostics, the genome sequencing, in order to look further into your microbiome. Have you utilized any of these advanced diagnostics?
No, I didn't even know it was a possibility until the conference, and that's something that excites me endlessly. The closest I've ever gotten to anything like that is through working alongside Evie to sort of map out my microbiome.
Yes.
But I would love to do a much deeper dive.
Yes, I couldn't agree more. The next gen sequencing, I think, is going to be super important in finding where your homeostasis or where your body lives in a microbiome fashion, as well as getting down to the actual DNA level of what resistance patterns each of these bacteria have within them, so you can have the appropriate targeted therapy. So often it's just like, well, Keflex kind of works, so we're just going to go with Keflex, And so having a more advanced diagnostic to lead to more improved treatment options for patients is something I'm super excited for, as well as it's just as important as it is for the acute infection. It's also knowing where your body rests, right? Like what is normal for your body and how do we get back to that and how do we encourage that? And so one of the things that you brought up was the Evie swab, and that's one that I'm actually a big proponent of as well, is I think that it actually addresses, okay, maybe there's an aerobic vaginitis that's actually causing this. So do you have a colonization of E. coli in your vaginal canal? And so that's why you keep getting recurrent urinary tract infections rather than, okay, we just need to keep treating the bladder. And so I'm happy you brought that up, because there are further diagnostic options out there for patients to actually get to the root cause of your symptoms and treat them in a more appropriate way.
100%. That's actually what led me to the probiotics that I'm taking right now. And I've seen such improvement since I started doing this. It's a costly exam, and that's another thing that is really, really hard. These tests that are out there, these different kinds of procedures and products that are being developed, you have to have quite a bit of money to engage in these tests, to utilize these products that are out there. So it's exciting and the innovation is great, but to have to live and work so that you can just continue to figure out what makes sense for you so you can live another day. It's an endless hamster wheel that is very exhausting.
Well, that's why I think it's important also to have a provider that is knowledgeable in which products to use, right? There's a wide variety out there. You don't know if they're CLIA certified or what lab they're actually using and how that affects the actual outcomes of your test. Because that's what's really exciting about these is that it's not just the next-gen sequencing, but what labs have now done the clinical rigor to make sure that you're actually getting the best information to treat your symptoms. And I don't think that, that's easy for patients to navigate in a world that's just advertising of like, okay, here's the next-gen sequencing. This will give you a better, output. Well, do we know if the actual analysis that they're doing has the clinical rigor that is going to actually identify the right bacteria for them? So having a provider that's knowledgeable in which test is actually shown to be clinically superior is really important because there's a lot of money that goes into these. And I don't think it's right for patients to feel like they're wasting their money on these tests. And so getting some direction from someone who's utilized them and has already appropriately vetted them, I think is important.
Yeah, absolutely. And that kind of goes back to what you and I had discussed previously about a centralized hub for details, information, what's available out there. It's in so many different pockets of the internet that unless you do this perfect deep dive, there's no way you're going to figure out and understand what's out there, what's worked for everyone. Things that have been right under my nose for decades, take so long to find. And then to understand, how it works with my own body and my own set of issues is a totally different kind of experience. It takes a lot of time, effort, energy, money. It's wonderful that those options are out there. But oftentimes when there's innovation in a telehealth capacity, it can be a little bit sloppy, which is why I think Clinova is so special. It's the kind of telehealth offering without the let's fly the plane as we're building it model that is so very unique to health tech and telehealth. And I think that that's unbelievably important because so many of us are in rural areas or we are not able to travel to get the help we need or engage in medical tourism. So there's a lot of innovation out there, but it's also a matter of making sure people have access to that information so they can utilize it.
And that's at our core. I want people, in the middle of nowhere, Michigan, to make sure that they have the expert clinicians to guide them through their care. Because, the rural physician if primary care physician isn't necessarily versed in, which microbiome test should they do? Should they or should they not treat this colonization? And I think that's the hard part for patients trying to navigate this. And so having the access through a telehealth option with appropriately vetted diagnostics and clinicians who are focused exactly on this is something that I'm really excited about because this is an emerging area of expertise. Is it traditionally infectious disease, urogyn, urology, PCP? I think it's a mix of it all. And just taking out those important parts that apply specifically to the patient is what we've tried to put together here and what we've done to make sure that you're getting the specialized care anywhere you need it. And so I'm glad you brought that up because it's something that's at the core of what we do is making sure that patients have experts at their side anywhere in the United States. And so thank you for saying that. I'm really excited to be able to bring that to patients everywhere.
It means the world to patients everywhere to have that kind of access. And it doesn't have to be perfect, just to know that it's there, the framework is there, and for patients to understand what options they have available, that's everything. So I'm so grateful for the work that's being done in the field by you and Dr. Bonder, as well as everyone involved with UTIGA. The work is transformational, and the fact that you can go your entire life without realizing the innovation that's happening behind the scenes, and you just feel like nothing's changing. I'm just doing the same rinse and repeat treatment over the years. That's not true. There's so much more out there, but you have to know it's there in order to go in search of it.
Yeah, that's what we're going to do here. We're going to make this better for patients. We're going to get them the right care where they are and whenever they need it. And I truly believe that this is a problem that we can solve. I think we just need to make sure that patients are aware that these options exist. And so thank you so much, Sarah, for coming on. Thank you for sharing your story, your journey, and how patients can help navigate something that they're dealing with as well. I think that recurrent urinary tract infections have been ignored far too long. And I feel that patients have just kind of tried to, fly by the seat of their pants to try to figure out, okay, how do I even start navigating this? And so to hear your journey and to know that they're not alone is something I think is really important for patients to hear. So thank you very much, Sarah. This was an absolute pleasure.
Thank you so much for the opportunity, Dr. Bonder. It's been wonderful.
Absolutely. We'll be connecting again soon, and I'm hoping to have patients hear more about your journey soon.
Thanks so much.